You think anesthesia came from a chemist's flask. Some of it came from a flower garden. And it almost killed as many people as it saved. Imagine standing inside a wooden operating theatre in the middle of the 1800s. You are strapped to a table. Your surgeon holds a small jar of dark paste made from a common garden plant. If the dose is too small, you feel everything. If the dose is too large, your lungs stop. For most of recorded history, that was the only choice medicine had. This is how one flower changed that, and why it took 5,000 years to do it. Our story starts not in a lab, but in the ancient world. Egyptian physicians recorded poppy-based remedies in a medical text now called the Ebers Papyrus, dating to around 1550 BCE. That document lists poppy juice as a treatment for pain, used before and during surgery. To extract it, a healer would score the green seed pod with a blade. A thick white sap blotted out and trickled down the pod. Left to dry in open air, that sap hardened into a bitter black gum. Small doses made pain fade into something dull and distant. Greek and Roman surgeons used it on sponges pressed to patients' faces before cutting. But every physician who worked this way hit the same lethal wall. The gum was not a medicine with a predictable dose. It was a chemical mixture of completely unknown strength. One batch harvested after a cold, wet season contained almost no active compounds. The next batch, grown in dry heat nearby, held enough to stop breathing in minutes. Every patient who received a dose was a calculation made with no real numbers. Surgeons had found the most powerful pain-blocking substance in the natural world. They had no reliable way to measure how much of it existed in any given scoop. That problem would sit unsolved for over 2,000 years. The reason was buried inside the plant's own chemistry. Raw opium is not a single compound. It is a mixture of more than 30 distinct alkaloids in unpredictable proportions. Some block pain signals in the nervous system. Others slow the heart and suppress breathing toward a lethal stop. Physicians for centuries tried boiling and filtering the raw gum to control its strength. None of those methods separated the useful chemical from the dangerous ones. Then, in 1804, a 21-year-old pharmacist's apprentice in Paderborn, Germany changed everything. His name was Friedrich Sertrunner. Working alone in the back of a small pharmacy, Sertrunner dissolved crude opium in acid and then added ammonia to the liquid. A white crystalline powder separated out and settled at the bottom of the flask. He had pulled a single pure compound from the tar. He named the crystals morphium after Morpheus, the Greek god of dreams. For the first time in history, a physician could weigh an exact milligram dose of a plant's active ingredient. The purity problem was solved, but within months, a second wall appeared. Sertrunner swallowed his own powder to test the effects. The drug worked, but only after a slow and unreliable delay. Stomach acid destroyed a significant portion before it reached the blood. What finally arrived came at unpredictable speed, and sometimes dangerous concentration. For surgery, a drug that takes an hour to act is useless. Sertrunner had solved purity. He had created a new delivery problem in its place. In 1853, a Scottish physician named Alexander Wood solved the delivery problem with a hollow needle and a glass syringe. Wood's device placed a fine needle directly beneath the skin, bypassing the stomach entirely. His first patient was a woman with severe nerve pain in her face. He injected measured morphine near the affected nerve, and the pain stopped within minutes. News of the technique spread quickly across European medical circles. By the American Civil War, morphine injections were standard in battlefield surgery. Surgeons controlled both the dose and timing with a precision that had never before been possible. Pain was no longer something patients simply had to survive, but morphine injections solved only one half of the surgical problem. The patient was free of pain. The patient was still completely awake. You now have reliable pain blocking. You do not have unconsciousness. And without it, no surgeon could safely open a chest or a skull. A patient who feels no pain can still flinch, tighten muscles, and shift at the worst moment. A surgeon inside the ribcage or cranium needs the entire body absolutely still. Morphine sedated patients slightly, but sedation and surgical unconsciousness are completely different things. Doctors knew a second ingredient was missing. It was also sitting in a garden. In the nightshade family of plants, there grows a group of species that does something opium cannot. Belladonna, henbane, and datura all produce a compound called scopolamine. Scopolamine does not block pain signals. It blocks the brain's ability to form new memories while producing a deep semi-conscious sedation. A person given scopolamine remains partially responsive but wakes with no memory of what happened. In the early 1900s, an Austrian physician named Richard von Steinbichel began combining the two plant compounds. He injected morphine for pain and added scopolamine to erase consciousness and memory together. He called the resulting state twilight sleep. The patient lay quiet, registered nothing, and remembered nothing on waking. Two plants, a poppy and a nightshade, had achieved what neither could do alone. But twilight sleep was still imprecise and carried risks when the doses were not perfectly balanced. The margin between a working dose and a dangerous one remained dangerously narrow. Medicine was closer to true surgical anesthesia than it had ever been. It was not quite there yet. The final step came not from a new plant, but from a new way of framing the problem. In 1926, a physician named John Lundy at the Mayo Clinic proposed a different approach. Instead of searching for one compound that could do everything, Lundy argued for using 3 separate compounds at lower doses, one to block pain, one to produce unconsciousness, one to stop all muscle movement. He called this balanced anesthesia. With 3 drugs sharing the work, each could operate at a lower and safer dose. No single compound had to carry the full burden alone. Modern operating rooms still run this exact logic. An opioid, a direct descendant of the poppy, handles pain. A separate hypnotic agent handles unconsciousness. A neuromuscular blocker handles the muscle stillness required for surgery inside the chest or skull. 2 of those 3 components trace back to a garden. Now here is the obvious question. Could you harvest a poppy pod and achieve the same result at home? The chemistry is real. The compounds are genuinely present in the plant. It should work, except for the one problem medicine spent thousands of years trying to solve. Raw poppy sap has no fixed dose. One pod grown in thin, dry soil might contain almost no active morphine. The pod beside it on the same plant might hold a concentration several times higher. The difference between a therapeutic dose and a lethal one is only a few milligrams. A few milligrams is a margin too small for anyone to control without laboratory measurement. That unpredictability is exactly why medicine had to leave the garden and enter the lab. The flower was never the problem. Knowing what was inside the flower, that was the problem that took millennia to solve. Every step in this story removed one layer of uncertainty from something nature had already built. Purification removed the uncertainty of the mixture. The needle removed the uncertainty of the delivery. The combination approach removed the uncertainty of relying on one compound to do everything. The garden did not fail medicine. Medicine learned, slowly and at considerable cost, to read it accurately. We started with a blade against a seed pod. We arrived at a precisely calibrated 3-drug combination in a lit operating room. The distance between those 2 points is not a story about chemistry. It is a story about how long it takes a civilization to stop guessing. Which step do you think mattered most? The isolation of the pure compound, the invention of the needle, or the idea of combining everything together?